Hi friends, this is Dr. Abdequaem Chimthanawala. Today let me share a case, a very peculiar case that came to me, peculiar symptoms he suffered from. That's why a peculiar remedy I prescribed to him. He came with his family member. The husband was sitting, the wife was there, and the husband was sitting like this, still. So I asked him, he brought the file also that he was taking a lot of medicine, and I asked him what the complaints you have. The wife said, sir, he does not want to take medicine. He feels that he is not ill. Then the husband told, नहीं मैं बीमार नहीं हूँ, क्या प्रॉब्लम है? मैं खाना खा रहा हूँ, सो रहा हूँ, बातें कर रहा हूँ, मुझे दवाई की जरूरत नहीं है. That means the patient was trying to tell, I am not ill, I am eating food, I am going outside, I am sleeping properly, I don't want medicine. She wants me to take medicine, and I can like this. And the wife kept on telling me symptom for about half an hour. I was writing symptom. I'll tell you the gist what the wife was telling. She is telling that ये तब से वैसे बैठे रहते. He sits like this, चुपचाप बैठे रहते. He sits still, does not talk to anybody, does not want to go out, does not want to meet anybody, just want to sit still. And we are taking this psychiatric medicines, and he goes to sleep after taking the medicine because the medicines are very strong. And this has been for the past 1.5 to 2 years, and somebody told us that the allopathy medicine can never be stopped, so you start homeopathy, and that's why I came to you. Sometimes he is sitting, and then when I tell him something, he starts weeping. Then when I ask him why are you weeping, so he says, no, I am weeping because weeping is also good, that weeping will take out all my anger. He is like that, but he does not want to take medicine because he feels he is not ill. And she said she suffers from pain sometimes in the head, the right side. Then he sometimes complains of pain in the abdomen. Then he sometimes complains about pain in the knees. He complains about pain in thighs. And we keep on going to doctors. And when he takes painkillers, he's better. He's back to square one. But the most important symptom is he does not talk. He's just sitting silently, and he feels that he is not ill. So he doesn't want to take medicines. Then he told husband to go out, and then she told me that sometimes he take medicine, and sometimes, most of the time, we have to mix medicine in the water so that we can give him, otherwise he does not take medicine. He feels that he is not ill. So this was a case, and of course when she was trying to tell the symptom of pain, she was very particular. Shoulder, abdomen, knee, leg, only one-sided symptom she was telling, especially on the right side. She said, no sir, sometimes you get symptom on the left side also, left. So, but at one time only one side is affected. This was peculiar, that one-sided complaint of symptoms. But this was the symptom that he is sitting. He does not want to do anything. He has so much work, sir. He is such a good person. He has so much work, but वो दूसरा कोई बोलेगा तो काम करेगा. बात आखिरी तक आ जाएंगी, आप काम नहीं करेंगे तो लॉस हो जाएगा, फिर काम करना शुरू करता है. Means somebody else will tell him, then he will start doing work. The work will come on the brink. If he does not work now, then he starts working on the last day, on the last part. He does not start working immediately, and he does not start working because he has to work. He works because on the last day, if he does not fill the electricity bill, if it does not give the EMI, then we will have EMI on EMI, interest on interest. Then he'll start paying the bills. He will become that type of person. Now if you go to see that if a person thinks that he is not ill and he's taking psychiatric medicine, in medical science it is called as anosognosia. Anosognosia, ANOSOGNOSIA. You have to understand what is anagnosmia. It is a deficit of self-awareness. Matlab the patient is not self-aware of the surrounding, what is happening, and actually he is ill and he requires medicine. It's a neurological term which was put forth by Joseph Babinski in 1914. He called it lack of insight. Lack of insight, a way a person feels that he is not ill, he has inability to understand and perceive his own illness. Lack of understanding and perceiving his or her own illness. That is why person suffering from schizophrenia or bipolar disorder refuses to take medication and does not go for treatment. So this is a term, anosognosia. Anosognosia, you have to remember this word, lack of self-awareness. That's why these type of patients of bipolar disorder or schizophrenia does not want to take medicine or does not seek help. Now, it happens to people who are suffering from stroke or traumatic brain disorder or Parkinson's disease or multiple sclerosis or Alzheimer's. These all patients suffer from this disorder. Now, if you go symptom by symptom in this type of patient, he'll give you the list of symptoms and symptoms and symptoms, all fancy symptoms, and sometimes most of the polychemists cover these symptoms, but still you fail to cure that case, which I suffered in this case. I prescribed many drugs, there was no change. Then I repertorize this symptom, anosognosia, thinks that he is not ill, schizophrenia, company aversion to, sit still and silent. One word the patient was telling, he does everything on last day, last part. He does not start any word. That is lack of initiation, weeping causeless, and one-sided symptom. If you repertorize these symptoms, a very rare drug comes to a repertory chart. For the first time, I prescribed that drug to that patient. And from that day onwards, I learned a lot of things about that drug. I started studying that drug, and now I've prescribed in many of patients with very good result. And the drug was Thalamus. Yes, Thalamus. I gave him the drug Thalamus 1M. I gave him about 4 to 5 doses in a space of about 3 months, 4 to 5 doses, and waited for 6 months. He started getting relief from the second month itself. Gradual improvement he had, because he was already taking other medicines for 1.5 years, and gradually after the second month the symptoms started improving, and in a course of about 8 months I found this patient totally cured, totally off all allopathy medicine. And now when he comes to my chamber, he's so energetic, he's so vivacious, he wants to work. He tells me, sir, I've wasted my 2 and 3 years of life because of the disease. Thank you very much. And now I have to again come back. I have to come back so that I can, जो लॉस मुझे हुआ था 2-3 साल से, मैं पूरा भरपाई कर सकूं. And that was his wordings with this Thalamus 1M. So my friends, go home and read again Thalamus 1M. And if you prescribe on those symptoms, do contact me so that I know that we have added one more remedy to our kitty, that is Thalamus 1M. That is Thalamus. So my friends, if you like this video, please do share and subscribe. Thank you.